Hello everyone, a very warm welcome to the Smart RN channel and thank you for logging in. My name is Henry. In our video recording today, we are looking at asthma, which is another common respiratory condition. Asthma is a chronic condition that affects the airways. In other words, it does not affect the alveoli. It only affects those pathways which are used to move air in and out of the lung. It causes swelling and narrowing of the airways. And this swelling and narrowing of the airways results in an intermittent and reversible airway obstruction. So when we have asthma, our airways are narrowed, our airways are swollen, and the result is that they obstruct the flow of air into and out of the lung. But we are saying that this obstruction is intermittent. In other words, it is not continuous. It happens, stops, happens again, stops, like that. And then number two, it is reversible. There are various steps that we can be able to take to reverse this swelling and narrowing. For example, by the use of medication. Asthma is normally a result of exposure to irritants and other risk factors. And this exposure to irritant and other risk factors results in what we refer to as bronchospasms and inflammation. So these bronchospasms and inflammation caused by the irritants are the ones that are going to result in an asthmatic attack. Now, during normal breathing, we take in air through our mouth or through the noses, and our air travels down the trachea, then the main bronchi, into the bronchus alveoli ducts, all the way to the alveoli. Now, in the alveoli, we have actual gas exchange. Remember, we said that the alveoli is the functional unit of the lungs. So in the alveoli, we have gaseous exchange where oxygen moves from the air into the bloodstream and carbon dioxide moves from the bloodstream into the alveoli so that it can be breathed out. Now, this happens in a normal way when our pathways or our airway conduction pathways are clear and not swollen at all. If you look at our airways, they are made up of smooth muscle. And this smooth muscle gives it the ability to relax or contract. In other words, these smooth muscles can be relaxed or they can be contracted. And then in the airways, we also have a thin lining of mucus. Remember, we have the goblet cells that produce mucus, which helps to trap any pathogens or any foreign objects that might enter this air pathway. So in a normal airway, we have got a normal lining, a thin lining of mucus. We have got relaxed, smooth muscles. But in an asthmatic attack, the smooth muscles become tightened. As a result of the bronchospasms, these muscles are going to be tightened. And when they tighten, they constrict these airways, resulting in a narrowed passageway. We also have a lot of mucus that is going to be produced. And this mucus is going to further narrow that pathway through which air has to flow in this particular airway. So that's why these people have got difficulty moving in air. Why? Because the muscle, the smooth muscles are tightened, and there is a lot of mucus which constrict this particular airway. So in an asthmatic attack, the airways are very narrow and they are swollen as a result of the bronchospasm and inflammation, as we are going to see. So what are some of the causes of an asthmatic attack? Or what are some of those causes? Or what are some of those irritants that can result in asthma? One, we have got cigarette smoke. Now, this affects both the smokers and the non-smokers. So the non-smokers are normally exposed to second-hand smoke. So this can trigger an asthmatic attack. So both smokers and non-smokers have a risk of an asthmatic attack as a result of cigarette smoke. Exposure to mold can also cause asthma. We also have got dust particles in the air. We have got animal dander. We have got people who can have an asthmatic attack as a result of exposure to this particular animal dander. We have got air pollutants, all those pollutants in the air. Viral infections, and especially in the upper respiratory system, can trigger an asthmatic attack. We have got food and drug allergies. We have got people who are allergic to certain foods. They are also allergic to certain drugs or medications. Now, when they're exposed to these particular things, then it might trigger an asthmatic attack. Some people may be allergic to very strong perfumes. This could also trigger an asthmatic attack in these people. We also have got occupational irritants. These are irritants in our places of work. For example, some people are working in paint industries. You find that the smell from this paint can actually trigger an asthmatic attack. We also have got cold or dry air. Cold or very dry air can also cause an asthmatic attack. Physical activity, strenuous physical exercise. Exercise can also result in asthmatic attack. Then we have got emotional stress, very strong emotional stress. When you are stressed, you could end up having an asthmatic attack. So these are some of the risk factors that can expose one to asthma. Now, what normally happens? We have just said that when we have bronchospasms and inflammation, we have an asthmatic attack. And these bronchospasms and inflammation as a result of these irritants and the risk factors that we have just seen. So what normally happens? Now, when you are exposed to any one of these, when a person is exposed to an irritant, what happens is that we have got an immune response. Our immune systems normally respond. Now, during an immune response, we have got what we call immunoglobulin E antibodies. These immunoglobulin E antibodies are normally used especially when we have got allergic reaction. So our immune system produces IgE antibodies, and these IgE antibodies normally attach to receptors on mast cells. When they attach these receptors on the mast cells, we end up having what we call degranulation. These mast cells degranulate, and when they degranulate, they release immune mediators, and especially histamine and leukotriene. Now, these histamine and leukotrienes are going to cause vasodilation. So in an immune response, we have just said that in an immune response, we have got IgE antibodies, which are going to attach to mast cells. When they attach to mast cells, we have got degranulation. Degranulation causes a release of immune mediators, histamine and leukotrienes, which result in vasodilation. So when we have got irritants in our respiratory system, as we have just said, the immune system is going to respond. And when it responds, the histamine and the leukotrienes which are produced are going to result in vasodilation. The blood vessels are going to be dilated. This dilation will cause more blood or more fluid to flow into these areas where there is an effect, and this is because the blood is flowing in those areas to bring the white cells and especially the neutrophils and the basophils so that they can help to mediate against these particular irritants or any pathogens. So what happens that the histamine is going to cause vasodilation, the blood vessels are dilated, there's more blood flowing to this area, and also we are going to have more permeability. The vessels become permeable, so fluid is able to leak out of these vessels as they bring the white blood cells, the basophils and the neutrophils to these areas to help in mediating against this particular irritant. So when you have got more fluid flowing out of the leaky blood vessels, then we are going to have swelling. We are going to have edema. So we are going to have edema that result in this particular blood, in these airways getting swollen. There is a lot of fluid in that area, so it results in what we call edema. So the vasodilation will cause the basophils and the neutrophils to be moved to that area. The vessels are going to be leaky. In other words, they are going to be permeable, and fluid is going to flow out, and this will result in accumulation of fluid in that particular airways, resulting in what we call edema. So we are going to have edema as a result of the leaking vessels in the airway. Number two, the immune system will also overreact and result in production of thick mucus. Remember, the mucus is used to trap any object or pathogens in the airways. So what happens that these goblet cells are going to produce a lot of mucus, and as they do that, they are going to decrease the space through which air can flow in this particular airway. So remember, we have got edema. The airway is getting swollen because of the fluid which is leaking into that area. We also have a lot of mucus which is being produced. So what is that? The result is that we are going to have a very narrowed airway through which air is going to flow in this particular airway. So we have got excess mucus that result in a very swollen lining of this particular airway. So we have got edema and also thick mucus resulting from this particular inflammation. Remember, we also said that we have got bronchospasm. Now, these bronchospasm are going to result in constriction of the smooth muscles. We say that our airways here are made up of smooth muscles. These muscles are able to relax and they can also constrict. So during an asthmatic attack, we have got constriction of this of these smooth muscles, and this constriction results in more narrowing of the airway. So we have got thick mucus, we have got constriction, and this causes the airway to narrow, causing problems of breathing in these particular patients. So what are the signs and symptoms of asthma? When we have this asthmatic attack, what are some of the signs that you are going to see in these patients? One, we are going to have dyspnea. This is difficulty breathing. Remember, the airways are narrowed. The airways are constricted. So these patients have got difficulty breathing. They have got difficulty moving in and they have got difficulty moving air in and out of the lung. So this results in shortness of breath. And then we also have use of accessory muscles of respiration. Now, asthma causes increased work of breathing. These patients, because of the narrowed airway, they have to work harder to move air through their airway. So we are going to see increased use of accessory muscles. For example, the sternocleidomastoid muscles. We are going to see increased use of the external intercostal muscles. So they breathe using these muscles to try and move air into and out of their lung. We also have wheezing. This you are going to hear musical sound as air moves through this constricted airway. So we are going to have wheezing. At the beginning, we have got expiratory wheezing, but as time goes by, you have both expiratory and inspiratory wheezing. The patients also feel chest tightness and pain. They feel that the chest is very tight and is very painful because of that increased work of moving air through constricted airways. The inability to talk in complete sentences. This is one of the features of those people when they have an asthmatic attack. It is very difficult to speak in complete sentences. They speak one word at a time. Why? Because they are gasping for air. There is reduced air. They are experiencing shortness of breath. So they cannot be able to speak in complete sentences. And then they have got increased anxiety. They are very anxious because they feel like they are dying. They are feeling short of breath. So anxiety increases in this particular patient. They also assume a tripod position. This is a position whereby they lean forward and they support the upper trunk or the upper body with their hands. Either when they are sitting, they can lean forward and put their arms on their thighs, or when they are sitting on the floor, they can bend or lean forward and put their hands on the floor. They support the upper part of their bodies by use of their hands. That's a tripod position. So patients, asthmatic patients, will always assume that particular tripod position because they are trying to make it easier to be able to move air in and out of their lung. Then their inability to lie flat. They cannot be able to lie flat. So they are always assuming a high Fowler's position or sitting upright. So because it is difficult to move air in and out of the lung. Then we are also going to have a drop in peak flow meter readings. Remember, peak flow meter readings normally help us determine how much air we can move out of our lung. So if you look at their peak flow meter readings during an asthmatic attack, they are lower than their normal peak flow meter reading. So all these are the signs and symptoms that are prevalent in patients when they have an asthmatic attack. How do you diagnose asthma? Asthma diagnosis can be done in a number of ways. One, we have got a patient history. Now, when you visit a healthcare provider, when you go to the doctor, he's going to obtain your history. He's going to look at, for example, in your childhood illnesses, your exposure to irritants, how often do you have this attack. He's going to collect a history of how asthma is running in your families. So from this history, the healthcare provider can be able to diagnose you with asthma by just looking at the details that you are provided during the patient history collection. Then we have got pulmonary function tests. There are a number of tests that we can use to diagnose asthma. One, we have got spirometry. Now, spirometry is used to measure how much air we can move in and out of our lung, and also how easy and fast we can be able to move this air in and out of our lung. So spirometry can also be used to diagnose asthma, especially when your movement of air in and out of lung is not normal when compared to those set values. Then we also have forced expiratory volume in 1 second. This is used to see how much air you can move out in the first second forcefully from your lungs after a normal inspiration. After normal inspiration, they find out how much air can you forcibly move out in 1 second. When you look at those values, you find that they are reduced when compared to your normal values. We also have got peak expiratory flow rate. This one measures how much air you can forcefully blow out of your lung. So when you're allowed to blow air out of your lung forcefully, they can look at that value and see that it's different from the normal. We also have got pulse oximetry. This is an invasive method where we look at the oxygen saturation in our blood, the hemoglobin. So you can also look at that, and sometimes the signs and symptoms are very slow to develop. So when you start if you use this method, you can see from the beginning when the oxygen saturation begins to go down. So we can use pulse oximetry to look at how how hemoglobin is saturated with oxygen. And then we can also perform arterial blood gases. We can draw blood from your arteries, and then we can look at the partial pressure of carbon dioxide. We can look at the partial pressure of oxygen. We can look at the pH. And then we can also look at the acid-base balance, whether we have got whether it is alkaline or whether it is acidic. But remember, when this condition is starting, patients normally tend to hyperventilate. So when they hyperventilate, they blow out carbon dioxide, and this might result in alkalinity. But as the condition continues to grow worse, it is now difficult to move that carbon dioxide out of the lung. So we end up having acidity. So these arterial blood gases are just going to show us what is the condition of a patient at that particular time. So these are some of the methods that can be used by healthcare providers to diagnose asthma in this particular patient. Now, what are some of the nursing interventions that you can be able to carry out when you are caring for patients with asthma? One, nurses perform assessments. You carry out assessments in these patients, and one of the things that you assess are the vital signs. You are going to look at the respiratory rate, you look at the heart rate, you're also going to look at the oxygen saturation in the blood. You remember that pulse oximetry. So when you look at these values, you are going to realize, for example, in an asthmatic patient, because they have got difficult moving air in and out of their lungs, they tend to have a higher respiratory rate. They are breathing so fast to try to move air in and out of their lung. The heart rate also increases because, remember, there is a reduced oxygen saturation. So the heart trying to pump even faster to move oxygen to the tissues. When you look at the pulse oximetry, there is reduced oxygen saturation. So those are the things that a nurse is going to assess when caring for this particular patient as regards the vital sign. You're also going to realize that you look for the use of the accessory muscles in this patient. Remember, we said that because of difficult work of breathing, the patients are going to use accessory muscles. For example, the sternocleidomastoid muscles, the intercostal muscles. They are going to breathe using these muscles because the work of breathing has become difficult. So they try to use the muscles to move air throughout their respiratory system. You also observe a tripod position. These patients are going to assume a tripod position. They are going to support the upper part of their body using their arms. They are going to lean forward and support this upper part of the body by use of the arm. Even when they are sitting on a chair, they lean and put their arms on their thighs, or when they are on the floor, they put their arms on the floor as they lean forward. So that's a tripod position to try and get air in and out of the lung. You're also going to assess the breath sounds. Remember, we said they are going to have wheezing. At the beginning, we have got expiratory wheezing, and as time goes by, we have got both expiratory and inspiratory wheezing. Wheezing is that musical sound which is produced as we breathe. So we are going to assess their breath sound. You're also going to realize that these patients cannot speak in complete sentences. They speak one word at a time. So you are going to assess that in this particular patient. How are they speaking? Are they speaking one word at a time? This because they cannot be able to speak in complete sentences. We are also going to draw blood and be able to look at the arterial blood gases. We look at the pH, the partial pressure of carbon dioxide, the partial pressure of oxygen. We look at the acidity, the acid-base balance. So we draw the blood and perform arterial blood gases. These are the assessments that nurses are going to perform when caring for this particular patient. So normally, because of the breathing, you are going to help this patient to assume a semi-Fowler or high Fowler's position so that you can be able to breathe properly. And then there are those actions that you are going to undertake as a nurse. One, administer oxygen. Remember, these patients are experiencing shortness of breath. They are taking in very little oxygen. So because of reduced oxygen saturation, they need supplemental oxygen. So you are going to administer oxygen to this particular patient. You are also going to administer any medications which have been ordered. Remember, we are going to have medications, for example, the bronchodilators, which are going to dilate the bronchioles so that air can easily move in and out. We are also going to have the corticosteroids, anti-inflammatories to mediate against inflammation. So all those medications which have been ordered for this patient is the work of the nurse to administer them as ordered. And then as a nurse, you also provide teaching. There are various teachings that you are going to provide to this particular patient. And one of them is teaching about an individualized written asthma action plan. Every asthma patient must have a written asthma action plan. This is a plan that you follow as you manage your asthmatic condition. As we are going to see, it has got three. It has got the yellow part, the green part, and the red part. You are supposed to know what to do during at any given time as you follow your asthma plan. So you are going to teach the patients about an individualized and written asthma action plan. What you do as you manage your asthma with the symptoms when you don't have an asthmatic attack, when the symptoms are coming, or when you have got a severe asthmatic attack. You must have a plan. So it's the work of the nurse to teach these patients about that particular plan, as we shall look at later on. Then teach these patients how to identify and avoid triggers. Remember, asthma is triggered by exposure to one of the irritants. So every patient must be able to identify what are his or her triggers, and then you avoid those particular triggers. So teach these patients how to identify and avoid those particular triggers. Number 3, you provide medication education, how to administer their medication. For example, you only use short-acting medications when you have an asthmatic attack. But when you don't have that attack, you don't need to use those particular medications. We have got those long-term medications that protect against an asthmatic attack. So you are providing education about this particular medication. And also, you are going to teach these patients how to take the medication. If you have got a bronchodilator and a steroid prescribed at the same time, you are going to teach these patients, first of all, to take the bronchodilator so that their bronchioles can expand. And then after the bronchodilator, you can now take the steroids so that those steroids, because of the dilated bronchioles, the steroids can go to the farthest point of those particular airways. So if you have got both a bronchodilator and a steroid prescribed at the same time, first of all, take the bronchodilator. Let the bronchioles be dilated. Then after maybe 5 or so minutes, then take the steroid so that that steroid can be able to penetrate to the farthest end of those particular areas. So you are teaching these patients how to take the medication. You also teach them about pursed lip breathing. Now, pursed lip breathing, this is when you breathe as if you are blowing in a straw, as if you are blowing in a straw. So or you are blowing a candle. So what happens is that you take in air through the nostrils and then you blow out slowly as if you are blowing on a candle or in a straw. Now, this act of pursed lip breathing helps to elongate exhalation. And because the exhalation is now longer, it is going to make sure that we clear air out of our lungs. We breathe as much air as possible out of our lungs. So teach them about pursed lip breathing. They breathe as if they are blowing in a straw or they are blowing off a candle. So as you do that, there's more air. You lengthen, you elongate the exhalation, and the longer you breathe out, the more air you force out of the lungs, the more carbon dioxide you force out of the lungs. So teach them about pursed lip breathing. Then teach them about smoking cessation. This is very important. If they are smokers, they must stop smoking. Why? Because the smoke is an irritant. It irritates the airways and causes this asthmatic attack. And also teach those non-smokers to keep away from secondhand smoke. Let them not be exposed to secondhand smoke, because that will also trigger an asthmatic attack in them. So teach them about smoking cessation, and that is a very big factor. Apart from smoking cessation, teach these patients how to use a peak flow meter to obtain values that show how they are breathing in and out, or how they are blowing air out of their lungs. And you can compare the values during an asthmatic attack to the values when you don't have an asthmatic attack to see the discrepancy. You're also going to teach them how to use a nebulizer, during an asthmatic attack. And then teach them cleaning of equipment to prevent infection. For example, how you clean these nebulizers. There's a way you clean them so that you can prevent infection. So all these are the interventions that a nurse can undertake when caring for those patients who are having an asthmatic attack. So that brings us to the end of this video on asthma. As always, please drop a comment, share this video, like this video. And if you are not a subscriber, please subscribe to this Smart RN channel. That's the best method that you can help us grow in this particular channel. From me here today, it is a goodbye.